Welcome to another episode of Corridor Conversations, a podcast dedicated to highlighting the many collaborative partnerships driving growth and opportunity across the Iowa Lakes Corridor region. I'm Kurt Strauss, President and CEO of the Iowa Lakes Corridor Development Corporation, which is your regional economic development organization serving Buena Vista, Clay, Dickinson, and Emmett counties. And once again, we are recording from the Spencer Collab space on the third floor of downtown Spencer. There's ever an opportunity or a chance that you need just a space to be able to share with your coworkers or just to break away, the Spencer Collab space in downtown Spencer is your spot. So I'm extremely excited to be joined in studio today with Jill Barr from Spencer Hospital and LINC, which LINC we're going to get into here in a little bit, but it is an acronym for the Local Initiative for Networking and Collaboration. So we're looking forward to Jill to diving into that a little bit. And today, our conversation is going to be a unique one, and it's an important one, which we're looking to have. It's going to focus on the economic power of mental well-being, and as we like to call it, workforce well-being, right? We need a healthy workforce to be able to be productive in today's society. So, Jill, again, thanks for joining us today. Just to start us off, maybe give us just introduce yourself, a little bit about your role at Spencer Hospital, and maybe just a little bit of a high-level introduction to LINC and what that's all about.
Absolutely. Well, thank you for having me. I
Yes.
appreciate being here and appreciate the importance that the corridor puts on this topic because it is something I don't feel like is too much discussed in depth. And so this is a great opportunity to share this information. So as he said, LINC is the local initiative for networking and collaboration. So LINC, we love acronyms, but that's what that one stands for. And I think it kind of describes what we're doing perfectly. So just in all transparency, I am not a clinician. Today's talk is just for educational purposes only, but I can connect you. If you have questions for professionals dealing with mental well-being specifically, I'm happy to connect you to those people. We've got a lot of great providers in this community that are willing and that want to help. So basically, we just connect. There was a stakeholder study that was done in 2021 that identified that we needed to have some more communication, have some more collaboration with our partners, our behavioral health professionals in the area, and more suicide prevention and education. And so behavioral health providers, believe it or not, they have so much, they're so busy. They have a lot to do with less. And so they didn't have the time. I mean, there's always a need. And so that's kind of where I came into the picture. So I've been serving as the outreach navigator for LINC for just a little over 3 years in Clay County. And it's been a great time. And I appreciate everything and getting to know all of our providers. And again, just how motivated they are to help our communities.
Yeah, well, like I said, I'm really looking forward to this conversation because as we talk about, one of the key initiatives for us in economic development is workforce development and workforce retention. And I give so much appreciation to today's world and society, Jill, and the fact that it's being more, it's talked about more freely. And we're going to get into that a little bit about, it's okay to talk about the issues that are maybe going on and that you just need to be, get that off your chest and be able to talk about that freely. I also have a huge appreciation for acronyms. In the economic development world, we're acronym driven all day, every day. And I remember when our current chair, board chair, Nate Whitmack from Renco, one of the first board meetings, he comes in and says, Kurt, I know you guys use acronyms all the time. I have no idea what they mean. So you just dumb it down a little bit and tell me what USDA means and what IEDA means, which USDA, and IEDA, Iowa Economic Development Authority, just let us know what those mean. So I have appreciation and understand where you're going with
Absolutely.
that. So, yeah.
And if there's any stories you want me to know about Nate is my brother-in-law.
Oh, that's right. We did have this conversation. And maybe we should just get this out there for the viewers because you and I had this conversation. And Nate Whitmack, for those that don't know Nate, look him up because one, he's a great human being. But number two, if you're a golf fan, he looks just like Scotty Scheffler. And I tell him that all the time. So make sure you tell him he looks like Scotty Scheffler.
No, I did
with
before.
That beard.
We had that conversation. Yeah. He's like, everybody tells me that.
But once you see it, it doesn't go away. It's wholly in there. So, well, great. So we're going to just give a quick shout out to our sponsor, Medlar Coffee, Carrie and Heather Belgrave, who drive our Corridor Conversations podcast each season, this being season 2 already. Jill, again, thanks for being here today. So to kind of break the ice for our Medlar moment, we call it, just kind of a couple of little icebreaker questions to kind of ease the set here a little bit. And so we're drinking coffee. We got coffee today. That's one of the things we get as a perk for for our podcast. What's your go-to coffee order? I know you got a little ice there, and I'm a black coffee guy, and I know that's not what you're drinking right there. What's your go-to?
No, well, so today I was feeling a little special,
Yeah.
and so thank you to Medler. Today I got a Stolly, which is like the raspberry white chocolate, and
Okay.
it is very delicious. So if
All
I
right.
want a little something special, that's what I will get. But typically, I like an Americano.
Yeah.
I'm also just plain, and that can be iced or hot, kind
Yeah.
of depending on the mood that
Yeah.
day.
No, absolutely. And this weather's been really nice for February, so you're
Hmm.
probably in like limbo. Like, is it a hot day today, or is it ice? Because it's like 60 degrees, so that's kind of
Right.
right in the
Maybe
middle.
it
That's a
depends
tough
on the
decision.
it
Tough
depends on the
decision.
day.
Yeah, that's funny. What's one small? So we talk about the mental health side of things. What's maybe one small habit you as a professional rely on to maybe reset or recharge during a
Mhm.
busy week?
That would be gratitude.
Mm.
If you could just take a moment, if you're feeling down or if you're just having a tough time, you're busy, you're overwhelmed, think of just something that you're thankful for. Each one of us has good things going on in our lives. And if you just take that minute just to express gratitude, it can be for something large, it can be for something very small. Typically, that kind of lifts you up a little
Yeah.
bit and you're kind of reset and ready to go. And really, I guess I encourage all the listeners focus on a moment of gratitude each day.
Yeah.
That's a great way to start and bring up any time of the day.
Yeah, great advice. I greatly appreciate that perspective. So let's just kind of dive in, and I think this is again, I'm looking forward to this conversation, and how it all kind of intertwines with economic development and workforce development, and
Mhm.
maybe just provide a high level overview of why mental health well-being really matters, and how that really kind of goes into community vitality and economic or employment vitality, if that makes
Mhm.
sense.
So, just at a high level, everyone has mental health.
Hmm.
If you have a brain, you have mental health. And so, your brain is just as much of a part of a body as your arms or your legs. And so, the simplest answer that I can give you is that the healthier the community is, the stronger overall
Yeah.
it's going to be. If your citizens are healthy, your community is going to be healthy, and it's going to have vitality. And that goes over all aspects, including workforce, including quality of life. And then from time to time, you'll hear me say behavioral health too,
Yeah.
because that encompasses mental health and addiction recovery. A lot of the time, the two are intertwined.
Sure.
So, in our discussion today, you'll probably hear me use both terms.
Yeah. Yeah. So what changes maybe have you seen over the last few years? We kind of talked about this evolution in discussing mental health and how that kind of translates into our organizations. But what kind of evolution have you seen or changes have you seen in communities and organizations over the most recent years? I'd say 5 to 10 years.
Yeah. So people are beginning to talk about this more and
Yeah.
more, which is a good thing. Each of our communities does a community needs assessment, and behavioral health is identified in all of those as a
Yeah.
priority focus. The Dickinson County Behavioral Health Coalition has their Let's Talk initiative, which I think is great. Clay County has LINC, and also Emmett and Buena Vista are exploring opportunities for this kind of focus. So something else that I've noticed, so we had a big shift
Mm.
starting in July of this past year. Iowa's behavioral health system went to a state model instead of a county region model. And so there's an emphasis on outreach efforts there. Also, 988 and Seasons Mobile Crisis Line, all of those things have grown through the past couple years as well in that crisis response, and are visible in the counties. I would say probably some challenges on the other side would be the stigma, and then also kind of that rural culture of intense
Yeah.
self-reliance. But overall, conversations are increasing, and I think that's a positive thing. And so again, I'm thankful to be here today and thankful for the corridor for having this conversation and
Yeah.
sharing that with your listeners today.
Yeah, for sure. And you hit on a kind of a key word there that kind of sticks out to me. Is the stigma part of it. Um, some people just, some people's not the right way. I mean, people just don't feel, they haven't felt comfortable because there is that stigma attached with mental health. Well, if I have mental health issues or if I'm dealing with stuff, I don't want to be the one to talk about or burden somebody with my maybe issues or concerns. And you say mental health, who has mental health? Well, everybody does. If you have a brain, you have mental health. I think that's a perfect way to put it. So everybody deals with it. So to be able to break down that stigma and be able to openly talk about it is huge. And as we go in and talk with a lot of our large employers, we talk about employment and workforce recruitment and workforce retention. And they are talking about it more, Jill, which I think your message is getting out there, and the work that you guys are doing at the hospital and through LINC is being effective. So you talked some about the partners that are in mental health and some of the things, the programming that's across the state and the regional aspects of that. Can you talk a bit more about how some of those partners are working together from the state and maybe a regional approach?
So, starting at the state level, so when they changed that focus from the county regions, the state kind of over the past couple of years has looked at the makeup of the entire state, the population, services, so on and so forth. They divided it now into different districts. So now each district, which we're in District 2, Buena Vista County is in District 1.
Okay.
And so they are looking at those as a whole. Each one has roughly about 14. I know District 2 has 14 counties. Each has a district lead. And then from there, they also have system navigations. And both of our district lead and lead system navigator are both located here in the corridor area. So I think that that's a great strength for us. But Iowa Primary Care Association holds the contract from Iowa HHA for this kind of setup overseeing the state.
Yeah, that's good. It's good information to know. I think it's kind of how that all outlined and with the kind of the coverage area there. So, so we talk about, economic, our employers, kind of starting to prioritize this, and communities maybe starting to prioritize the mental health thing. What happens economically when communities maybe don't necessarily, or employers don't necessarily prioritize the impact of what mental health can have?
Yeah. So when they don't prioritize it, especially in rural areas like ours, there's a higher risk for injury at work. There's a higher risk for suicide, more presenteeism or showing up to work when you're unwell, turnover, all costly for the region's employers who depend on reliable staffing.
Yeah.
I have kind of a neat little tool, which I brought in.
Love tools.
The National Safety Council, in an independent research institution, NORC, another acronym, at the University of Chicago. They put together and they collaborated for a cost calculating tool that you kind of input, where the state you're at, the industry you're in, and the number of employees that you have. And then it calculates the cost of what mental health is, and that includes depression, anxiety, just general mental distress. And so I'm gonna just show you this really quick. And I put together kind of a fictitious input here, but so we put in, and maybe we could have a screen of this later that you could put over the top.
That, yes.
But so I put in for the state of Iowa, our fictitious employer has around 500 employees, and the industry is manufacturing durable. And so calculates the total cost is $649,498. So that breaks down to about $191,000 in just lost time alone, $229,000 in job turnover and retraining, and then $229,000 in the health costs that go with that. So you can expand this a little bit more, and it'll kind of give you some statistics too. If you are a big numbers person, I think this is really interesting, but it calculates. So again, for that company, there's 344 missed days of work due to illness. Now that can be mental health challenges, that can be the flu, that it's kind of all inclusive there.
And this is a 500-person employer.
This is 500-person employer.
Almost not quite one person per day.
The number of days of work skipped was 249, and the number of employees who will cause a safety incident is 8. So I think from those type of things, that's really important when you're tired, when you're ill, the safety concerns. Annual turnover, they're looking at 13 employees. And those, the healthcare stats, maybe 9 days in a hospital, 12 emergency room visits, and 115 outpatient visits. So it's interesting.
Yeah, it is very interesting.
Yeah. So they say that mentally distressed workers cost employers over $2,800 in healthcare services per year, more than their peers. They can cost over $4,700 a year in extra days of work missed. and each mentally distressed worker cost an employer over $5,700 in costs related to turnover.
Yeah.
So you can then scroll down a little bit further, and it tells you statistically, out of those 500 employees, 37 of those are likely to maybe have a mental health challenge. Now, I said before, everybody has mental health,
Yep.
and that varies good or bad every day.
Yep.
Some people, they have a challenge with it.
Mm-hmm.
And so that's what that represents and affects there. And then dependents and families, 65. So that performance at work then does radiate in that distress, to their families
Yes.
as well, and that well-being. It breaks it down by mental health conditions. Now, again, this is general, but out of those 500, 27 of those employees may be suffering from depression, 17 from anxiety, 17 from suicidal ideation, and 14 from substance use comorbidity, which means they have the mental health and the substance tied together, which honestly, nobody looks to have a substance use problem. They're trying to deal and find coping strategies, and unfortunately, substances are one of those.
Sure.
And so we want to try to address that as well. So it does say for every dollar invested in mental health treatment, there's a $4 return on improved health and productivity. So it does affect the bottom line. So I think this is kind of a neat tool. So I can share, we can put the web address up there if you wanted to kind of go in and play around with that with your actual stats of your company and industry and kind of find out what that number is.
So that's a website that companies could go in and input their specific employer numbers and get kind of the same numbers, Jill. Is that be accurate?
Yes. Yep.
Yeah.
They put down, what's specific to their
them.
industry, and then they'll get different numbers.
Is there a cost to that for them to participate, or that's a
no,
free service?
Absolutely.
Awesome.
It's just
I think
free
that's
service
great.
on a website.
Yep, I think that's great. We'll definitely get that shared out and make sure that people and companies are aware of that. And you go through that, it kind of answers actually my next question, because this is going to be more professionally for me, and I kind of knew the answer anyway. But my next question was going to be, how should economic developers or individuals in our field, like the corridor, and how should we be thinking differently about mental health and how it impacts us? And I think you kind of showcase that really a high level, just based on the number of the dollars that goes into our employers to be able to retain and make sure our employees are healthy, so we don't have that turnover.
Yeah, I think it's great. Think of it as workforce infrastructure, just like you would with childcare and with other items there. Employees should be aware of what their local resources are and other supports like 988, the local crisis and talk line, Your Life Iowa, system navigations, EAPs that actually work and workers remember and use, evidence-based trainings like mental health first aid and question, persuade, refer, and anti-stigma campaigns like Make It Okay, which is offered for free as well from the Iowa's Healthiest State Initiative. And again, LINC, we can help make connections if anybody's interested, because a lot of these things are offered and those trainings are offered locally.
Yeah, that's great.
So connect you up.
Yeah, and as a follow-up to this, when we get concluded and put this episode out there, we'll put all the links in for our listeners to get to and have easy access to.
Yeah,
so
the LINK.
The LINK. I love it. So let's get into some regional insights. We do cover 4 counties, Jill, as you know, for economic development. We talk about Buena Vista and Clay and Dickinson and Emmett, and there's probably different shifts in all 4 different counties, right? Because we pride ourselves in diversity up here, and I think that's part of what makes us unique. And are there any similarities or unique challenges across the region that maybe you see differently, or maybe can you just shed a little bit of light on what that might look like?
Yeah, so I used the Iowa Health and Human Services county snapshots.
Okay.
Those are also available online if anybody wants to go check those out, but that's where my statistics came from today. And also that is drawn from the county health rankings and reports. And so all 4, for similarity, all 4 corridor counties are in a shortage area for mental health professionals. In terms of poor mental health days experienced per month, the range was 3.9 to 4.8 days per month. Dickinson and Emmett were at or above the state average of 4.5 days. Buena Vista County had the lowest number. Poor mental health is linked with, the economic stability and income, housing and transportation, food insecurity, and physical health, all of which can increase stress. And then again, as I mentioned, the use of the maladaptive coping behaviors like the use of substances,
Yeah.
all which affect the workplace in the ways that we've talked about earlier, like absenteeism, presenteeism, and productivity.
Yeah. That's very good. So yeah, so how do all those role dynamics and how do they collectively, like, just talk about the resources, how does that shape the access or maybe the stigma as we talked about and maybe ultimately the outcomes?
Yeah. Well, I'm going to step back just
Yeah.
one to finish. I'm going to add to my last
Yeah, you
question,
bet.
and add just a statistic that people should be looking at in our counties is also the use of alcohol. Alcohol use and excessive drinking. Iowa, we're higher than the
Hmm.
state average of 23.3% in three of the four counties.
Yeah.
But alcohol is the most commonly misused drug and substance in the state, and again is linked to
Yeah.
injury and
Yeah.
suicidal injury risk and productivity. So I just wanted to just throw in a plug there
Yeah.
that since we are higher in most of the areas, employees just might want to, or employers may want to just pay attention to that. But in terms of the rural dynamics, when we discuss with our professionals, always the things that are coming up are housing and transportation,
Yeah.
routinely discussed. Rural, we see the challenges in our area because we have longer commutes to get uh, to our providers, limited transportation options for some. So providers are always working on those ways to increase access. The utilization of telehealth, I think,
Hmm.
has helped and has been an option. Rural dynamics, including your really close knit social networks, where everyone knows everyone,
Yeah.
I think contributes a lot to stigma. Again, that culture of self reliance, and then limited anonymity. Um, People fear that they're going to be judged,
Hmm.
and so because they fear that judgment and being gossiped about, that often leads to people not seeking treatment. And then also another effect is isolation,
Yeah.
which is
Yeah,
damaging as well.
for sure. They just aren't talking about it at all. And yeah, no, I agree. And those are challenging. And to get the people to feel comfortable about coming out and talking about it with somebody they feel comfortable with in the workplace, I think is
Mm-hmm.
vitally important. So, all right, let's talk about that acronym that we've been kind of pushing off here a little bit. LINC, LINC. Jill, you want to just maybe explain a little bit what is LINC and how did it all come together?
Yeah. So I believe, as I mentioned in the beginning, 2021, there was a stakeholder study that showed that we needed that increased collaboration, increased and improved communication, knowledge of resources, and then somebody to facilitate all of it. So LINC was created, and we set the table for our behavioral health professionals. We have an advisory that is consisting of community partners like Spencer Hospital, City of Spencer, law enforcement, Spencer Schools, Lutheran Services in Iowa, Rosecrans Jackson, and Iowa Primary Care Association, and then also our District Advisory Council member that we have. LINC has collaborated. We've done a lot of things as well with our professionals, but also with our community, providing trainings and suicide prevention and education outreach.
Yeah. So obviously collaboration, we're huge supporters of collaboration. That's what we do in our organization as well. But how does that collaboration piece really, improve the outcomes instead of individually you all working maybe in silos or independently of each other? Like, what's the benefit there?
Yeah. So when you work in collaboration, you're really hoping to catch those people from falling into the gaps.
Yeah.
You're trying to bridge those gaps, and the collaboration and communication really also help with the duplication of
Hmm.
resources to avoid
Yeah.
that. And often communities, I mean, I think it's a little cliche, but we do more together,
Yeah.
and it's absolutely true. And when care is comprehensive and not fragmented, outcomes are going to be better.
Yeah. No, I agree, and everything, and everybody's got common cause, right, for the best case, the best source outcome at the end, and the
Mhm.
collaboration piece. All key stakeholders are on the same page. I think that works. That works well in all things we do. So.
Mhm.
So what are maybe some practical steps, for communities or maybe even employers they may be thinking, listening to this episode here, Jill, and just saying, how can I get involved, and how can I make a difference maybe with the day-to-day work that I'm doing? Like, what are some practical steps maybe communities or employers can take to strengthen their mental well-being within their organizations?
Absolutely. I have got a long list. So I start
This is
out
where
by
Kurt
saying
stops talking and
a
just turn it
few
over
years,
to Jill. And here we go.
a few things. So employers can normalize and support. I think that's the most important thing. Be a champion in your workplace with your company and regularly communicate resources and services. A lot of the time, you don't know what's out there because you don't know about it until you're in that situation. Let's have that all present beforehand. So maybe there's a higher chance of somebody, if they end up in a situation, they can be a little bit more proactive instead of reactive. Employers need to create psychological safety and a culture of trust and respect, which in turn creates more positive job satisfaction and reduces burnout. They can consider well-being policies regarding time off, hosting trainings again, to improve knowledge of behavioral health and stigma reduction. Again, we have a lot of local providers that provide these trainings. And some of the EAPs, if companies do provide that, they have some of those training resources as well. Making sure that there is meaningful alignment with leadership and staff and not a disconnect at that level. Offer opportunities for employees to connect and belong. I think Spencer Hospital does a great job of this, by either offering ice skating outings for the company or encouraging attendance at community activities. Go with your coworkers and do these things. They also, which I think is a great idea, incentivize employees to put the number for the EAP and save it into their phone, and then you take a screenshot and you send it in. So that way, again, if you find yourself in a position where you need that, it's right there in your contacts. And I think that's really, really great. And then, as I mentioned earlier, everyone has mental health, but some in our communities are living with behavioral health conditions every day. And meaningful, decent work can help them live a more stable life and keep them in recovery and contributing in the workplace. Employers can also find this really nice downloadable document. It's the Surgeon General's framework for workplace well-being, and it's got 5 key areas that it focuses on, which are the opportunities for growth, mattering at work, connection and community, work-life harmony, and protection from harm, which again is that safety aspect and security. There's questions that they can maybe look at and reflect on for potential implementation in their company, which would be: 1, do opportunities exist for rest within our schedules and our workplace? Are they adequate? How do we know that they're adequate? How might we create moments of social connection before or after our formal meeting agendas? How might we give workers more autonomy and a bigger voice in their duties? How could we provide more transparency when we share results of any workplace surveys that are taken for employees' ideas? And how might we provide equitable learning and development for all workers? So I think those are, that's just kind of a snapshot, but I think those are all, things that people can think about and reflect on and look at their own workplace and maybe start to implement.
I agree. And, employees are such a vital resource for our companies to be ultimately successful, Jill. I think you hit the nail on the head there. Ironically enough, we actually hosted a workshop today focused on conversational management. And one of the stats that the presenter presented to us today was that one meaningful conversation between a supervisor or a manager to employer exponentially increases their well-being in the organization, and eliminates a higher risk of them wanting to leave. They feel valued, they feel invested, and we talk about it all the time. You spend more time and hours at work on a weekly basis than what you do at home with your own family. And so employers have to look at that big picture and understand that we are a family, right? We need to treat our management, we need to treat our employees who are vital to our organization as a family. And how do we do that? And the resources you guys bring to the table provide that avenue, Jill. And I think people just need to be more apt and be willing to dive into it and see what those are all about.
Yeah, absolutely. And it is, I mean, that's one of the identified need on the
Hmm.
hierarchy of needs.
Yeah,
There is that love and belonging, and
right.
everybody needs to be connected. There was another Surgeon General's report on isolation, and I
Hmm.
feel like even though we feel like we're all more connected digitally, we're also really more isolated.
Right.
And so by finding that connection point, I think is extremely important for the mental well-being of people. They
Yeah,
need that emotional connection.
I agree. And we say it, and I don't think it's hidden anymore. I mean, the most well put together person. I mean, feel like they have everything dialed in. Can be dealing with stuff.
Hmm.
And so this day and age, like you have to understand, like you don't know what any one person is going through. Offer a piece of gratitude to anybody as you're walking across the street. I think you
Hmm.
talked about that today. Just the gratitude piece. I think that was a great piece of advice because just that simple hello, or you don't know what somebody's going through for that day, can really uplift somebody and just change their perception on life. I think us as individuals, every one of us, doesn't matter what role we're in. I think you would agree. It's like just be humble, be kind, be appreciative, and just say hi.
Yeah,
That could just make somebody's day.
absolutely. And it didn't cost you anything.
It costs us zero. And as an employer, the retention piece, if we can keep them in there and they understand that we're engaged and invested in them, I think that goes forever.
Yeah,
So
and as communities are looking at development too, that connection piece for placemaking is
yeah,
really important, and having those places like Medlar Coffee
yes,
or like Viso in Storm Lake,
yes,
which was your small
100%.
business
Yeah.
award winner, and creating places where people can gather and connect and be together is
Yeah.
really important.
I appreciate the perspective, and this conversation is great because I mean sometimes we do all work in silos. I mean everybody will run an organization this way or an organization that way, and everybody's right in doing that. But I think today's world and what we're hearing as we're talking with our large employers is that you do need to set aside time to let individuals be them. Set aside time for community days where you go out and help volunteer.
Hmm.
I mean,
Yeah, VTO
go
is a
go
great
right.
benefit.
Go bowling for an afternoon. Take them to a movie. Now, the bottom line isn't going to improve because of that. But I tell you what, the reinvestment of having to hire a new employee and training somebody to get them where they're at, because all you had to do was maybe go do a company outing, one time a month or one time a year to get that camaraderie and that team building up, and what that does for people in mental health, wanting to come to work day to day and feel valued and invested.
Hmm.
And those are just small investments companies can make to really retain and just really focus on the mental health side of it.
Hmm. Yeah,
So,
that's great.
but well, good. This is a great conversation. There's so much more. You gave so much good information, and we can't wait to pass that along to our listeners here today. But you are so experienced in the field, Jill, and you provide so much out there for our listeners. I want to know what's one key takeaway today, Jill, that we could pass along to our listeners to always remember as we leave this conversation today.
Yeah. The one key takeaway for our area, we have people who are here locally ready to help, whether that is through LINC for connections, or whether that is contacting one of our agencies for mental health first aid training. Um, they're there and they're ready to help. We have wonderful providers and professionals in our community. And if I could and to do a little story time, if that's okay. It's going to be kind of a short story because I might not be a great storyteller, but it is the story of the river. And some of you may have heard of this before, but it's a little ditty about Jack and Diane. So Jack and Diane are at a park and they are fishing for the day. And so they're next to the river and they have, their lines cast and they're waiting, and all of a sudden, they see someone coming down the river, just flailing their arms. They need help. So Jack goes over to the edge, extends his hand, helps this person out of the water. Crisis averted, right? So they put their poles back in, and not too long after, here comes another one, arms waving frantically in the air. This person struggling to stay above the water. So Jack goes over and again extends the hand and gets this person out. But no later than that person stepping upon dry land, Diane sees three more people coming down the river, flailing and asking for help. And so they're starting to get overwhelmed, but Jack's down there. He's helping as best as he can. And I came up with, yeah.
Yeah, and I laughed that time too.
Good. And so Jack's helping them out, but all of a sudden Diane's gone. And what Diane did is she went a little further upstream, and she was trying to find, there's so many people down here, there's too many, we can't help them. I want to go upstream and find out why they're falling in the first place. So short story, but if you can find those people and look upstream, which I think ties in with your workplace well-being, it's all a work of prevention. And so if you can prevent an employee from having that burnout and then leaving and having to replace them, if you can prevent the other high costs that we talked about of maintaining those employees, and just focus on some prevention and help them before they get to that place, I think we can all be in a little bit better situation.
It's a great story about Jack and Diane.
That's right. They're just doing the best they can.
Just doing the best they can. So
I don't know if that's copyrighted, but
yeah, check into that, Jenny. Make sure we're legit on that before we go to. Oh, that's awesome.
Chili dogs at thanks for.
Yeah, no, that's great. So if businesses, as a follow-up, want to reach out to you directly, is that something that they're able to do? Jill?
Absolutely. Okay. So yeah, they can reach out to me. My email is jill.barr@spencerhospital.org. And awesome. Yep, I'll respond back and work with them there.
Awesome. Well, we appreciate your collaborative partnership and thanks for being here today to have this conversation. And we look forward to continue our work with you and continue to make sure that mental health and mental well-being, and like we talked about at the onset, workforce well-being is on the forefront as we continue to drive our workforce priorities going forward. So with that, I want to say a huge thank you again to Jill for participating with our podcast here today. Huge shout out to Medlar Coffee as our sponsor and our location shooting here today from Spencer Collab. My name is Kurt Stroud, President and CEO of the Iowa Lakes Corridor Development Corporation, and we look forward to seeing you again next time. Thank you.